I know that people go into this community, into this industry, because they want to make a difference in someone's life. They have compassion to do so. Now, I think there's all of these red tape and these structural things that I feel is the prominent barrier that prevents this compassion to be sustainable.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management at the Naveen Jindal School of Management. Here at the University of Texas at Dallas, we bring together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare ecosystem. I'm Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management. Be sure to subscribe on Apple Podcasts, Spotify, or your favorite podcasting app to ensure you don't miss any of the future episodes. You can also join us online at businessofhealthcarepodcast.com.
Today is a very special edition for the Business of Healthcare podcast. Our guest today has an amazing life story to share, an incredible entrepreneurial business success, and a noble vision that creates value for many in the world of healthcare. I am both delighted and honored to welcome Chanda Hinton, Executive Director of the Chanda Plan Foundation, to the Business of Healthcare podcast.
Hello, thank you so much for having me here, Bob, and I'm excited to have a very meaningful conversation today, and I'm just so grateful to be here.
Very good. Well, let's get started with your life story. Let's share with the audience your background. I find it amazing, to say the least. So why don't you fill in the rest of us here?
Yeah, so my personal story is that I am a woman with a spinal cord injury. I was accidentally shot in the back of the neck when I was 9 years old. The bullet from the rifle entered between the C5 and C6 spinal cord area. And so it severed the spinal cord, leaving me as a quad. And so with that, my function is that I have no movement or sensation from the armpit level down. I have some limited mobility from the armpits up, obviously, and sensation. And with that, my personal life has just been that I've been navigating the world with the use of a power wheelchair and navigating the healthcare system, as when you have an injury or disability or diagnosis or anything medically, that's where you tap into that type of resource and use the medical model a lot to just sustain a lot of access to care and ongoing needs with your spinal cord injury. And so that's, my personal background in the sense of who I am and what brought me to this. And then obviously with that injury, I am now brought to a lot more of life and a lot more goals, in the sense that I hadn't imagined I would ever be and representing in the world. And so that's a unique opportunity and kind of the silver lining when it comes to injury. And I'm excited to share a lot more of that with you.
Well, I like the word plan. We're a business school and we have strategy and we plan things. And what is the plan in the Chanda Plan Foundation?
Yeah, I think that it's funny because I'm such a planner. I think that one is that with your disability, unfortunately, I think that I've had to plan a lot. I have to plan, from the very moment that I wake up with my caregiver. It's a very planned life. And I see that there's some beauty in plans, and oftentimes I want to be a little bit spontaneous. So with that being said, the plan around the Chanda Plan Foundation is that we really had a plan to redesign and recreate how healthcare was for persons with disabilities, in terms of being proactive and preventative with our healthcare, as well as really making disability competence around the various access to services that would be proactive and preventative, making sure that the healthcare population was aware of what does that mean, proactive and preventative? And also, if I'm going to do that type of care and model, how do I do it the best way possible? And so with that, when we started the organization 17 years ago, we struggled with a name, and I think that it's beautiful when things rhyme, but at the same time, the Chanda Plan just felt like it really stuck amongst the founding board members. And so, our plan has always been that, but it's always what I just shared with you, but it's also evolving over time. And so I think that's the beauty of plan as well, is that we create plans and we can make them grow and be different over time as we resolve issues. Those then new issues that we that come up, we want to get ready to make a plan to make it different.
Well, a lot of people that I've interviewed, they've had a story, not like your story, but they've all had a story. And quite often the story had a personal basis behind it. And it blossomed into something really significant. You had a dramatic change. I mean, obviously you had this terrible spinal cord injury. Your life was challenged. What dramatic change? What came about you that made you want to move forward with this entrepreneurial effort called the Chanda Plan Foundation?
Yes, and so like I had said before, it's when I was injured, I was really thrown into a medical model. And so kind of stepping back to that place where upon my injury, you name it, I had to take every level of medication to address my secondary conditions that accompanied my spinal cord injury, which is the primary condition, right? So here I was as a young little girl, 9 years old, sitting in a power chair and consuming a lot of medications. And also knowing that in that medical model, not only if the medications didn't always take care of, preventing a urinary tract infection, I was in the hospital a lot for UTIs, pneumonia, all of the things that maybe weren't able to be, addressed through taking a medication. And so for me, from 9 until 21, my concept of healthcare was I'm going to sit here, I'm going to take this medication, but at the same time, there's side effects that come with those medications. And then there's going to be things that medication's not going to address. And so in my mind, that was what healthcare was as a little girl and growing up to be 21. So, growing up to being an adult. And so when I became 21, I started having severe chronic pain. And so, I do what I know of the medical model. I go to my physician and share this. And that's when another medication was introduced to me, which was taking a Percocet. At that time, it was 2003, which is the very peak of the epidemic around opioids, and utilizing that for issues, knowing that that's not a long-term ideal state for anyone, that's short-term use. So for me, he just said, hey, chronic pain is another secondary condition that accompanies spinal cord injuries and disabilities. And so, from not knowing what I know now, I just had to trust, and that was the right decision. So I started to take that, and it obviously didn't work because now we know much more, but I became 59 pounds because that it was only masking a lot of the issues that I had around being proactive and preventative with my body. So it only masked the issue, but it made me significantly worse. So I stopped eating. I became bedbound. I was 59 pounds. I had to be hospitalized. So here it was, the medical model. Then I had to use medical intervention to save my life from a medical model that wasn't evolved around that proactive and preventative pieces that we'll talk about a little bit more later. But so the medical intervention saved my life. And at that time, the physician just said, hey, go back and do what you were doing before. And knowing that this physician took care of me since I was 9, we had a relationship where my sister, who's a yoga instructor, and I were able to say, wait a second, this doesn't sound right. Why would I take the medical model, use the medical intervention, and go back to doing exactly what I did before? So that conversation was really enlightening for us, but also for that physician who I am still friends with today and has thanked me to say, thanks for pushing against, thanks for being an advocate, thanks for opening my eyes to what a healthcare model could look like for long-term disability, because you were my first patient as a 9-year-old that I have been caring for. So then we went into this whole conversation about, well, what does that look like? And that's what I'm really excited to also share with you. But that's my personal story that brought me to preventative care, talking about preventative care, what that looks like, and making it not only available for myself, because it dramatically saved my life, which is why I'm on this podcast. But I knew that I had to make that available to other people. And then that's where the Chanda Plan came into becoming a reality in the world, and access for preventative care for a lot of folks with physical disabilities.
So you had this dramatic change, and you knew that there were literally hundreds of thousands of other people that could benefit, and they could have a similar dramatic change by doing what? What are these integrative services that you've mentioned before?
Yeah. So for me, when I talked with my physician and my sister, I said, he's like, well, what is it that you want to do different? I think that was the question, right? So my sister and I were like, let's look at massage, acupuncture, chiropractic, physical therapy. Like, let's look at what did Chanda's body do prior to her paralysis that created all of these wonderful things, right? Blood circulation, lymphatic drainage, bone density, like the things that we don't even know that our bodies are doing every single day to create just this level of wellness. So my doctor said, go for it. There's nothing at this point. We have nothing to lose. So I went and did that. The unfortunate part, which we can, get into, is that funding wise, our family and I had to just do it out of pocket, because when you access insurance companies, or if you go to Medicaid and say, hey, you're spending way too much money on doing sick care over here, when in reality, if you spent money on these services that are preventative and proactive to be a substitution for what my body was no longer able to do, that we're going to not only improve the quality of my life and others, but we're going to save money for ourselves, the taxpayers' dollars, like saving money within the healthcare world. It's like, we always want to do that, but then oftentimes I find it that we don't. So those integrative therapies are what truly saved my life. And now it's available to other people with disabilities here in the state of Colorado through our organization, and doing some legislative changes to now Medicaid in Colorado funds these integrative therapies, which is super phenomenal. Like, that's something that a lot of people don't believe we can do as individuals and citizens. And yes, we can. If I could change a bill, anybody can change a bill, is how I say it.
All right. Well, we want to get more. We want to get more into that, the legislative impact, because that's going to certainly be significant. And how to do that elsewhere to spread this into other areas is really important. I think most of us have heard the story of David and Goliath, and it sounds to me like sometimes a Goliath appears to bring out our David. And that's what you've done here. You've looked at what helped you and how this can help improve the life of other people, that surviving these day-to-day challenges, these disabilities, help people get the basic needs, get them back into their life and get them back into the community. And so they're not suffering all the time. I think that is a significant, noble cause here. Now, we talked about the word plan, and I'm going to mention this a couple of times in the podcast. I am the plan. I am the plan.org. I am the plan. So not only you have put together the Chanda Plan Foundation, but you've empowered other people to be the plan as well, to help those that are out there. And I think this brings up a bigger topic here that we really have to touch base on to some degree. And that really has to do with the whole idea of caring for people, the whole idea of compassion. And, today's world, in the healthcare world, I think sometimes we're starting to remove ourselves as caregivers, as providers, as physicians, as nurses, that, there's a lot of burnout that's taking place. There's a lot of emotional exhaustion. There's, people don't feel like they can make a difference. And it's kind of depersonalized the whole industry. How do we get this compassion back into the care element here? Tell us about what you've experienced in terms of that making a difference.
Yeah, I think that when we're all involved in healthcare, whether it be the actual individual provider that's delivering the service, or we're an advocate of it, because we can all be in connection to healthcare at different levels, right? And so, as an advocate, what I can notice within the healthcare world is that I know that people go into this community, into this industry, because they want to make a difference in someone's life. They have compassion to do so. Now, I think there's all of these red tape and these structural things that I feel is the prominent barrier that prevents this compassion to be sustainable. So when we get into like organizations such as hospitals or insurance, or I think that oftentimes puts the provider into a particular box that doesn't allow them to hold on to the whole purpose of why they went into medicine. And so I believe that deep down, all of us want to have compassion. We want to serve people. We want to change their lives. And then the exhaustion comes from those various pieces where if a physician needs to care for an individual with a disability that has a lot of complexity, right? But they only get 15 minutes with that individual and they only get paid for that 15 minutes. Like, this puts providers into a place where they're like, well, oh my goodness, how do I really effectively serve that individual if the structure is that I only get 15 minutes, I only get paid for that 15 minutes, when the complexity and the time that they deserve and need from me is far more intense. And so I think that we get caught up into the criteria, the time, the payment components of the healthcare that is actually detrimental to not only the compassion, but the access and the delivery of it. And so that's been my experience. That's been what I see of the individuals that we serve. That's been of the providers that I communicate with, is that they want to, but how? And how do we as an organization advocate to make that structure look differently, not only for the providers, but ultimately for the individual with the disability?
Yeah, sometimes we hear the term, what the health is going on here? There's 18 million healthcare workers in the United States, and I would absolutely believe that almost all of them came into this profession from a calling, not because it's a job. And, we have to make sure that this compassion actually is surviving the healthcare industry. We need to have a change that takes place, because we don't want it to turn into a job, because then it just becomes like any other customer service relationship. This is the most intimate aspect of our people's lives. And quite often it's the most darkest and most difficult times. And that's where you need to have this type of compassion and understanding.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
You did some amazing things. You talk about changing legislation. Most people don't realize, believe it or not, that Medicaid is it's a cooperation between the state and the federal government. Now, in Colorado, you actually initiated some change to take place, and I'm hopeful that others listening to this podcast can model after some of the things you've done there to make similar type changes take place in the states where they live. So tell us what you did with the legislation in Colorado and the process you went through to make change happen.
Yeah. I really believe in systemic change. And the reason why I believe in systemic change and what we've done here in Colorado, and how I know that others, upon hearing this section of our work, that they can be motivated to do it, is because it's feasible for anyone to do it. And I also believe that by looking at systemic change, we are addressing a problem and fixing an issue, knowing that as a grassroots organization, if we would have just stayed as an organization collecting donor dollars and giving individuals access to integrative therapies, we could have done that. But that wasn't, we knew that that would be not sustainable for the end user, knowing that if we were only going off of grants and individual donors, if we went away, then that meant this beautiful ability to access this preventative services and therapies would go away with us as an organization. So if we went away, how could we ensure that the individuals that we were serving would still have access to therapies that were proactive and preventative? And then with that, we needed to show Medicaid that by doing that with a very complex, costly population, us as a state, we would be saving money. So what I did is in 2009, just upon this impact of integrative therapies to myself, I said, you know what, I want to start a nonprofit that's going to do that donor service component, where we can absolutely get people services here and now, but for the longevity in the future and to really be a good steward of those dollars, I need to look at some systemic change. So I actually got a hold of a pro bono lobbyist, which those have been the people that have supported this level of systemic change the entire time. And I went down to the Capitol and just basically we got a representative and a senator, and we just proposed legislation to say, hey, we want Colorado to fund acupuncture, massage, and chiropractic for folks with spinal cord injuries in the Denver metro area. Let us prove to you that by funding these things, we'll have an independent evaluation to look at the cost effectiveness as well as the improved quality of life. So it wasn't as if I was going in there and saying, from a consumer, please do this and this is what you'll see. Let me also show that to you. And if you don't see that evidence, then pull it away. But if you see that it's cost effective and you see it's improving people's lives, then I'm doing exactly what we should be doing within the healthcare world. And so it was extremely successful. It was passed in 2009, the legislative body. What I loved is that each one of the legislators had a relatability. Themselves use these services. So when we were there testifying as individuals with disabilities, they were like, oh goodness, I use it and I don't even live with a spinal cord injury. I couldn't imagine what it would be like not having access. So for me, just knowing that with my ability to be healthy, and when I was healthy, I had this very large ability to want to tackle things because of my clarity and being healthy mentally, physically, emotionally, it really helped. And I think not only that, being healthy helps, but also living in a space of being naive and knowing that it's okay to not know, but your passion and the ability for people to donate their expertise and alongside yours creates a lot of amazing things that now in the state of Colorado, we have this, and every state has the ability to do it, creating a waiver. And I think more people, hopefully, that hear this will be able to want to advocate and do a similar thing in their own state. And we have a handbook that we can just basically give over and say, this is the playbook. Go into your state and do it, and it will be available for other people as well.
Well, that is an incredible accomplishment there. It's called the Spinal Cord Injury Waiver for Medicaid in Colorado. And it gives all these different, primary care, mental health, integrated therapies, all these things you talked about, and lets people really work together and collaborate around the person and make such a huge, huge impact on those individual lives. And once again, I keep referring back to IamThePlan.org. Go there and you can see the kind of impact that these type of services create. You know, barriers, you talk about barriers that are in place. And interestingly, just yesterday at the University of Texas, Dallas, where I'm a professor, they sent out a notice and it said, help us create an accessible environment, report a barrier. And this communication piece says, well, what is a barrier? And it says, it's event program access, it's media format communications, it's parking and transportation, perception, physical barriers, systemic barriers, technology barriers. And it says, hey, report this information, help us do a better job. And you've put together another organization, and this other organization has a competency curriculum, and it's the Chanda Center for Health. Tell us about that. That's quite a significant entrepreneurial business accomplishment. Tell us about that and the curriculum that you've created for healthcare providers.
Yeah, I thank you so much for bringing up that piece about barriers. And it's such a broad, there's so many different levels of how we can look at barriers. And so earlier when I was talking about, the barriers that provide or that kind of box providers into places where they feel like they don't know how to serve persons with long-term disabilities, or there's various barriers that come up for providers, and then there's the barriers that come up for the end user. And so when we look at those barriers, when I talked about, the payment for amount of time, the amount of paperwork that comes with individuals with disabilities, whereas the individual that is coming to get care, making sure that they can get from the parking lot into the building, into the treatment room, into the treatment room, onto the treatment table. So those are the kind of barriers that we look at when it comes to access to care, right? And so when we look at these barriers, we want to make sure that the providers, one, that they said, how do we get educated to serve this population? Because right now, the barrier, whether there's some funding components, it's also just that competency. And so what we did is we built a curriculum that allows providers to go through 7 different modules around disability competence, so that just overall they know what disability competence what does it mean, right? And why is it important? And what does the law say about it? And what do you do when you or to even know that you're competent or not, right? Like, where's the checklist that says, well, I'm doing real good here, I need to improve over here, right? So I think that without that education and resource, how do providers build their competency, know what to improve, make a plan for improvement? And so we've created a curriculum that includes that all-encompassing information that allows the providers to address their barriers in this area, which then ultimately will eliminate the barriers that are prevented to the end user, the individuals with disabilities that are trying to seek healthcare. But unfortunately, there's that continuous barrier that comes up for them that doesn't allow them to do that. And quite frankly, it's very sad, because then it leaves people with disabilities in a pretty significant health disparity, where their health issues, already having a disability, only get worse and don't get addressed. And so we're really excited for this to be something that starts to break down those barriers.
Well, Chanda, I believe that the population we're talking about is not those with disabilities. It's actually a much, much larger population. And, people ask the question, why do I have to adjust for the disability community? Why do I don't have patients who are disabled. Why should I care? And the answer is the population that we live in today in the United States is aging. I mean, 17% of the population in America today is over 65, and we're living a lot longer. And we all need this type of community care. We all need these types of resources. It's just not for a few. I think it's a much, much bigger environment. And, some of the research that you provide is just outstanding. 1 in 3 adults with disabilities, age 18 to 44, do not have usual healthcare provider. Wow, how can that be? And some of the different resources that are needed out there to educate people, you're making those available. We'll make sure that shows up on the podcast list of references for you, because I think that's so very important.
Absolutely.
Okay. We could go on and on. I want people to understand the importance of this, the value of this. You've been quoted. You have a motto. What's your motto? It's kind of cute. I think it came from Gandhi or something like that. Be the choice you want to see in the world.
Yeah. Be the change you want to see. Be the choice. Yeah, absolutely.
Yeah. That's a great approach. I mean, we all have to engage in some form or fashion. If we're not personally affected, we're going to have family members, community members, and others that have to deal with these issues. So I can't thank you enough for what you're doing. This whole concept of social justice is a very broad topic today, and every organization has supporting efforts here. But I think to focus this into the world of healthcare and bringing compassion back into the healthcare world is a goal that we all have in common, and we all need to work together for. So, final thoughts, Chanda. What would your request be for our audience here?
Yeah, my final thoughts would be that providers in the healthcare community take recognition, right? See that they did come into, as you mentioned, they came into healthcare to change lives. And yet we know that we as an organization are going to work on some of those systemic issues to make it easier for them, better pay, better for more time, support around the equipment that might cost them to be competent, to have the ability to be accessible. So we're going to work on that. But we want to do that in alignment with the provider community. So I think that the biggest pieces is to be aware of this and join the conversations where what can I do now, but also how can I be a part of the conversation to really change the systemic issues that cause those ongoing barriers. And so I just encourage providers to be aware and reach out in order to make a difference, as you mentioned, not only for the disability population, but for the population in general, because we're just a subset that if you're really good at this population, guess what? You're going to be good at serving all populations. And so that would be my ask and my recommendation. And I'm just so appreciative to be able to have shared this time with you and with others.
Well, I encourage our listening audience to become part of the plan. Join me in going to iamtheplan.org and learn more. iamtheplan.org. And there'll be a huge reward for you now and in the future by doing so. So it's been a great opportunity. We're so lucky to have Chanda Hinton, Executive Director of the Chanda Plan Foundation, be our guest today. Thank you, Chanda. We enjoyed this very much.
Thank you for having me. I've enjoyed it myself.
Thanks for listening to the Business of Healthcare podcast. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu/healthcare.